Hello again mga ka-listeners. Now we have to talk briefly about your macrolide antibiotics. So when we say macrolides, they're so-called macrolides because of their larger size. That is, there is a term macro, means large. Actually, it is a safe alternative to penicillin. Your macrolides can also use to treat infection affecting your upper respiratory tract and also lower respiratory tract, and also it is also intended for GIT infections. Okay, when you say GIT, that is your gastrointestinal tract infections, and for skin and soft tissue infections caused by many strains of bacteria like your streptococcus and haemophilus organism, and also for STI. What is STI? That is your sexually transmitted diseases. Example, your gonorrhea, your syphilis, and chlamydia. I also mentioned that in the part of your tetracycline antibiotic that it is also given for the ophthalmia neonatorum. And as I said, macrolides can also be given. I can also be used to prevent ophthalmia neonatorum. Again, your macrolides and also your tetracycline can be used to prevent ophthalmia neonatorum, the medical term for your neonatal conjunctivitis. What are the examples of your macrolides, by the way? Actually, they have their names. Romycin. Example, your roxytromycin. There is oromycin. You have a macrol, brand name Macrol. We have also your azithromycin, one of the common macrolides. We have your Zitromax, brand name is Zitromax. We have your clarithromycin, that is your Claricid or Biaxin. And also the most, actually your erythromycin as one of the example of your macrolides. That is the first macrolide to be developed and proved to be good alternative for patients who were allergic to penicillins. Actually, it is a drug of choice for the treatment of your, guess what kind of disease? It is the drug of choice for the treatment of your Legionnaire's disease, which is caused by the Corynebacterium diphtheriae. That is a causative agent, one of the causative agent, your Corynebacterium diphtheriae. And as I mentioned, since it is one of the first macrolide developed, it is also effective among infections that can affect the upper respiratory tract. Okay, it has a brand name of erythrocin and Eritab. We have also your erythromycin or Dynabac. So for familiarization, we have your RACE. Okay, RACE for macrolide. That is R stands for roxytromycin. A stands for azithromycin. We have your C stands for clarithromycin. E stands for your erythromycin. And D stands for your erythromycin. Okay, mycin. Your macrolide, which may be bactericidal or bacteriostatic, they exert their effect actually by binding to the bacterial cell membrane, and they change the protein function. And this action can prevent the cell from dividing or cause the cell to die, okay, leading to bacterial cell death, depending on the sensitivity of the bacteria and the concentration of the drugs. And as I said, that the macrolides are intended for Legionnaire's disease, it is also given for patient with infection caused by group A beta hemolytic streptococci strains that such as your Streptococcus pneumoniae that causes pneumonia. We have also your PID, okay, your pelvic inflammatory diseases, which these macrolides can be used. We have also intestinal amoebiasis. Okay, this is a condition wherein also your macrolides can be applicable. And I think I mentioned the STI already. Your caused by chlamydia, trichomatis, and Neisseria gonorrhoeae. your syphilis, we have your gonorrhea. So those are examples of your STIs. Um, what are the drug effects? I mean, the adverse effects of these drugs that nurses must be aware of. Okay, we must be aware that the most frequent ones can involve direct effects on on the GI tract and are often uncomfortable enough to limit the use of the drug. This includes abdominal cramps, we have your anorexia, and diarrhea, vomiting, and one of the serious adverse effects is your pseudomembranous colitis. Since I mentioned previously about what is pseudomembranous colitis, I hope you still remember what is pseudomembranous colitis. And also take precautionary measures upon giving this drug, especially in some other form of drugs such as your digoxin. Remember your digoxin. Your digoxin is the one that can interfere also with your macrolides. Again, the spelling of your digoxin, actually it is a cardiac drug. Okay. Later on, we will tackle about your digoxin as one of your cardiac medication. Digoxin, spelled as Digoxin, digoxin. Okay, increased serum levels of the digoxin in the blood when among patients who are taking this must take extra precautionary measures when they also take a macrolide because it has a drug to drug interaction. Okay, what else? The macrolide can be also taken 2 to 3 hours after meals. Okay, 2 to 3 hours after meals and should be taken with a full 8 ounce glass of water. I think that is your macrolides, and I integrated some of the important points, especially those adverse effects.